I'm going to tell you about conditions of the ear. You have the full text or text with gaps. I wouldn't suggest going in without any text, as this is long and technical in places. Wax. Some earwax is normal and good for your ears. The side effects of excess earwax can be earaches, infections, and not surprisingly some loss of hearing. To try and prevent a build-up of wax, use of olive oil on a regular basis can help. Microsuction is the safest way of removing wax, but generally not available on the NHS. Perforation. A hole in the eardrum. Can be caused by an infection, trauma, or loud noise. Can be harmless, but it will make the ear more susceptible to infection and can cause a mild to moderate conductive hearing loss. Troublesome perforations can be surgically repaired. Eustachian tube dysfunction. If the eustachian tube becomes inflamed, this means the tube cannot ventilate the middle ear. The air in the middle ear cavity becomes absorbed by the membranes of the cavity. This causes the eardrum to become retracted. It usually is just temporary problem during and after a cold. There are various other causes and sometimes it lasts longer. Eustachian tube dysfunction can cause dull hearing and a feeling of pressure or fullness in the affected ear. Eustachian tube dysfunction can lead to glue ear. Glue ear. This is characterized by a collection of fluid within the middle ear space. The membranes of the middle ear produce mucus or fluid. This is nature's way to stop the eardrum being drawn into the middle ear. It can cause a mild to moderate conductive hearing loss. Grommets can be used to surgically treat glue ear. If this fluid becomes infected, you have a middle ear infection. This is very painful and can cause a perforation. Glue ear is the most common cause of hearing impairment in childhood. presbycusis. This is caused by wear and tear to the cochlear hair cells and auditory nerve. It is a gradual loss of hearing in both ears. 1 in 3 adults over age of 65 have hearing loss. Because of the gradual change in hearing, some people are not aware of the change at first. It generally affects the high frequencies first. They take the brunt of the energy in the cochlea and wear out first. Hearing aids and lip reading classes are the best way to manage this. Sensory neural hearing loss. A hearing loss that affects the inner ear or auditory nerve. The sensory cells and neural pathways are affected. This can result in practically any configuration of hearing loss, mild to profound, affecting all frequencies. Conductive hearing loss. A hearing loss that affects the way sound is conducted to the inner ear. The outer ear and middle ear are affected. This generally results in a mild to moderate hearing loss affecting the low frequencies. Mixed hearing loss. a combination of conductive hearing loss and sensorineural hearing loss. Noise-induced hearing loss. A hearing loss caused by a blast of sound or prolonged exposure to high intensity sound over a period of years. It causes a ski slope hearing loss where the high frequencies are predominantly affected. Meniere's disease. Meniere's disease is an inner ear condition that can cause vertigo. It also can cause tinnitus, a fluctuating hearing loss, and a feeling of fullness or pressure in your ear. It is thought to be caused by too much fluid in the inner ear. It's not known if this is because of overproduction or lack of reabsorption of the inner ear fluids. Acoustic neuroma. An acoustic neuroma is a benign tumour that develops on the balance and hearing nerves leading from your inner ear to the brain. The pressure on the nerve from the tumour may cause hearing loss, tinnitus, and imbalance. Generally, the high frequencies are affected. The tumour will need to be surgically removed. otosclerosis. The condition is caused by abnormal bone growth on the middle ear bones. The abnormal bone growth finally encroaches into the cochlea in the inner ear. It causes a mild to moderate conductive hearing loss, becoming mixed. Surgery to replace the stapes, the smallest bone in the body, or hearing aids can be prescribed.